My name is Domaingue, Managing Editor here with WestfordCAT. Welcome back to our show. If this is your first time joining us, WestfordCAT has partnered with Westford's Community Wellness Department and Westford's Health Department to inform and educate residents on a variety of public health topics and initiatives within town. This week, we're joined with Brittany Nash, Westford's Regional Community Health and Wellness Coordinator. Brittany, though based in Westford, is shared between the towns of Westford, Acton, Dracut, and the city of Lowell. Brittany, you want to tell people a bit about what you do and who you are?
Sure. So as Ben said, I work as the Regional Community Health and Wellness Coordinator under a Public Health Excellence Grant, and my focus is mental health and substance use. It's not limited to that, but that's the main area of focus. So with that being said, I've been in the position for over a year, trying to manage what I'm doing within that position. And a part of the grant is to come up with 2 programs, and that is something that took time to do in the beginning. So one of the programs that I'm doing is I'm a certified youth mental health first aid instructor, and then the second program I went on to Breathe for Change, which is the only 200-hour yoga teacher certification and social emotional learning facilitator. So those were 2 of the things that I brought into the community. I'm not a social worker or a clinician. I get asked that a lot. So I like to focus on that I'm an advocate for those things. And although I don't have that background, I'm very passionate about those things. So that's a little about me.
Awesome. And we're also joined with Nicole Laviolette, who you may have noticed was on last week. We're going to be on here together each time we run a show. Nicole, do you want to briefly reintroduce yourself and just tell people a bit about what you do for those of us who may have missed the last one?
Sure, thanks, Ben. So my name is Nicole Laviolette. I'm the Community Wellness Coordinator for just the town of Westford. So with that, I am a support similar to Brittany for the community, for residents, town departments, the schools, anything really that touches Westford around mental health, substance use disorder. Really kind of reached out as far as parenting supports and all around supports for the community. So residents can connect with me if they have questions. We can connect them to referrals or information, but also I'm a resource for town departments, for the schools, for agencies or other venues in town if they have questions and concerns, and really an outreach and education around mental health, substance use disorder, and other information as well.
Absolutely. And you guys wouldn't be joining us if there wasn't a reason. And there are 2 big public health initiatives happening in April. April is Child Abuse Prevention Month, and the week of April 3rd to April 9th is also Public Health Week. So Brittany, I know, runs a variety of programs within town and provides quite a bit of education on Facebook, in person, online, anywhere you can get your hands on it to people in town on Public Health Week. So Brittany, can you tell us a bit about that?
Sure. So every April, it's National Public Health Week. Some of the topics we cover, some we go around and do our own topics, depending on what we're offering. So for Monday, we are doing youth mental health first aid. I know I mentioned that in the beginning. And what that really is, as an instructor, myself and a partner do this in the community for free. There's no cost associated to this training because we have received grant funding and work hard to give this for free. And it's ideal for any parent, educator, school staff, any adult really living, working with children or adolescents, whether you're a parent or not. Everyone knows an adolescent. And what the training does, it identifies and helps understand and respond to signs and symptoms of mental health and substance use challenges. So it's not diagnosing anyone, it's more of like a triage, continuous assessment of, where the youth is at, what they might be going through, continual assessment of, are things severe or would they get to that point? So this is a good foundation to have to protect the youth, to get them the services that they need as early as possible. So that will be April 3rd. We are hosting that at the Westford Fire Department. All you have to do is email me at bnash@westfordma.gov. I still have availability. I know with April 3rd really approaching, it would be ideal to email me as soon as possible, today or tomorrow, to be able to get you in that course. But if we can't, I'm continuously doing this, so it's something you can just email me and I will let you know of other existing ones that I'm running. I will be doing one in May in Drake-It. So I've taken more of a regionalized approach with everything that I do. So if I have availability in May, I will accept any resident to come and join that, because the importance of this education being out there is very valuable. So that's one of the things we're doing on Monday. For Tuesday, we're focusing on tobacco and vaping. So I have contacted the Northeast Tobacco-Free Community Partnership, and they will virtually be presenting on tobacco and vaping and the existing resources and the harmful effects of tobacco and vaping. This is ideal for any adult to be able to attend that, whether they want to quit or they're worried about their child. That's something that they could attend. Same thing by emailing me. And then on Wednesday, our assistant health director and our health agent will be sharing septic information that will be found online. I encourage you, if you're not following the Westford Health Department Facebook page, to do that. We put a lot of our programs and clinics out there, along with education, new information we find out. We like to give it on there, but also by mainly being subscribed to the town's main feed email, to be able to see everything existing that we do. Sometimes we do news flashes, so that could be directly to your email about the events that are occurring. So, and if it's a little difficult navigating the page, you can always put in the search engine exactly what you're looking for, which we've found helpful for people to do. But make sure to follow us on Facebook and follow us on our health department. And Thursday, our public health nurse will be offering Stop the Bleed. That will be from 11 to 12 at the Westford Town Hall. That requires registration. You can always email our public health nurse, which is Gail Johnson. That is gjohnson@westfordma.gov. I know this is a lot of information, so you can always reach us at the health department by calling 978-692-5509 to receive any clarification on the things that I'm speaking on. And she will also be doing on that Thursday a hands-only CPR. So there will be no CPR certification for that, no card handed out. This is a quick 2 or so minute refresher or introduction to what hands-only CPR is. So if you're interested, that does not require registration, but for more information on either Stop the Bleed or hands-only CPR, that's stuff you can find online. And then for Friday, as I mentioned before, I am a Breathe for Change yoga teacher, so I will be offering a free guided meditation. Hopefully the weather cooperates on April 7th, because from, I believe it's 10 to 11, we'll be doing the guided meditation on Edwards Beach, weather pending. I'm really excited about that. That has been well received in the other communities, so it's something I'd like to bring here. Especially for Westford parents or just adults in general. That is what the guided meditation will be focused on. So this is a lot of different things that we're running that we're excited about. I'm excited to do all these mental health and substance use initiatives, especially with Nicole having her support. It's been wonderful to work closely together. I'm just thankful to be here and have guidance and direction in this position. And if anyone has questions, email me. I am more receptive than anything. Anything I can do to help, just let me know. Thank you.
Absolutely, and all of that information will be included in the video description, and we'll be sending it out, and we'll be sharing everything the health department shares during the week on our Facebook page at WestfordCAT. So, going a bit further on some of those things, I know you had mentioned Thursday the department is doing the hands-on CPR, but there's no certification. What if someone wants to get certified? Does the town offer that? Is there a way someone could do it?
Yeah, so Gail has done a few CPR classes for the community. It's been well received that we have to put people on the wait list, which is exciting. You know, people cancel and then they're able to fill that with the wait list that we have. But also, the more received it is, the more she can put that out for the community. So that is something we do offer. But specifically for Public Health Week, we're doing something where we can reach more people, just kind of like a mini hands-on only CPR. But that is something that is offered. So stay tuned and look forward to having you in a CPR class.
Absolutely. And I know you had mentioned that you're a Guide for Change instructor with you know, meditation and all that. Go a bit further on that. I mean, what exactly is that? Why is it important to you, and why is it important to, I guess, public health?
Yep. So Brief for Change is the only certified 200-hour yoga teacher training with the social emotional learning facilitator. And I wanted to take that for my community, focusing on my community. What can I give back? Not realizing what the training did for myself in my own personal life. So I took it as a way to include and bring wellness to light, knowing that I'm not a social worker or a clinician, but what value can I add? So that's something I'm passionate about. I've been actively doing it. I don't know if anyone has seen or heard. I've been coordinating with the Westford Rec Department, and I've been going to different elementary schools. I just completed a program at the day school, and I do social emotional learning with the kids. We've done really fun activities. They've been really receptive to it. And the goal for social emotional learning is self-awareness, self-management, relationship skills. We go over all these things while doing fun activities and just having conversation. It's typically 8 sessions or so, and then I will go on to another school. And the reason why I'm doing that is prevention. So I focus on prevention. And when I think about mental health and substance use, if children don't have the foundation or the skills to be able to cope or manage and have resiliency, then they're more likely to engage in risky behaviors. So that's kind of where I've implemented some of the things. Just passionate about teaching kids the skills that they need for the world that we live in, and hoping that it makes a difference. But with prevention is something that you can't see. So sometimes it's challenging to say, you know, am I doing enough, or are these kids learning? But then you receive little comments or hugs from the children and different things that make you know that what you're doing is worth it. So that's one thing I'd like to say about prevention as a prevention person, is you don't always see it because you've prevented it potentially. So it's a challenging field. With that program as well, I do a guided meditation in Acton. I coordinate with the Acton Library. That's been really receptive. I have a good group of women. It's been like 9 one week, and then it's 12 the other week. Tomorrow I'm doing it at the Acton Library, and I think the last time I checked I have 12 registered again. So it's been really awesome to see me taking something, but not just take it for myself, to expand it and introduce it to everyone else has been amazing and fulfilling, because you get that feedback. I like, you know, they say, oh, I really like how you do this, or that was awesome, thank you, Brittany, and then they show up again. So those are some of the things with that program that I've been doing, and I continue to want to do for the community, not just for Westford, but Lowell, Acton, Dracut, anyone who's willing to work and receive what I'm giving, I'm willing to help and want to be a part of. I'm very persistent on the things that I'm offering. So yeah, does that kind of answer your question?
That more than answers my question. It you know, from what I'm getting is this social emotional awareness is sort of tied to, I guess, someone's, I don't want to say tendency, but, you know, someone's, I'm forgetting the word, but their risky behaviors, I guess.
Like a correlation,
yes.
Being able to have those skills
Yes.
to not engage in those behaviors later on. Yeah.
Absolutely. And I'm glad you brought up students and kids, because April, as we mentioned, is also National Child Abuse Prevention Month, and these types of risky behaviors, such as smoking, vaping, or anything of the sort, normally parents would probably want to avoid having their kid, partake in those risky behaviors. But I guess going on child abuse prevention and neglect prevention and all that, Nicole, do you want to speak a little bit on that?
Sure. So as you said, April is National Child Abuse Prevention Month, and to kind of go off of some of the things actually that Brittany shared, a huge piece of Child Abuse Prevention Month is bringing awareness to child abuse and neglect, but also to bring light to communities around prevention. So that piece of an awareness around the different aspects of abuse, but also what can communities do to prevent the abuse within families and children. So there's huge components that different communities do, and one of the pieces I wanted to share around today is, what services and what is available within Westford and the surrounding communities to support families and parents, so that they don't get to that place, to support families with the prevention aspects, so that we can try to prevent child abuse and neglect in Westford and Massachusetts.
Absolutely. Well, it seems like the theme today is really about prevention and, I guess, harm reduction in a way.
Absolutely.
So you had mentioned there's a number of resources for families. Could you go a bit further on that?
Sure. So there's some great resources within Westford and the surrounding communities. So a few pieces. As we're speaking, there's this statewide phone number. It's Mass 211. So Mass 211 is a number that you can call to get any type of resources that you might have a need for around financial, so with childcare, so parent supports, anything that you really can think of, you can call Mass 211. They also have a website that you can look into as well. Lowell has a family resource center that's a great support for any families that are looking for parenting classes or a place for questions around their children. So they have a phone number. They also have a drop-in center. Westford has a parent support group. We meet the second Thursday of every month in Town Hall, and that support group is really for parents that have children that are having mental health challenges. So it's an amazing support and resource for parents to get together and communicate with other parents that are going through similar situations, learn a skill, and also get support from peers and from those that are facilitating around those challenges. So those aspects are really to provide parents the skills that they need and the supports that they need in hopes to prevent child abuse and neglect. So there are, we could talk for hours on the list of resources and supports. They can be listed on our websites. The Mass 211 is a great piece. As far as that follow-up, the Department of Children and Families is another resource that has a website that has a list of resources and supports for parents as well.
Right, absolutely. And one thing I always like to ask is, something like, I guess, child abuse or mental health or anything is what does it look like? How can someone who is not experiencing that know the signs, know when to take action, know when to do something? And I know Brittany had mentioned, her meditation, social emotional awareness with children. You see that harm reduction and that prevention in person. You see you're making a positive impact. But obviously, the world's not perfect, and people may have a negative impact on their child, be it through actual physical abuse or emotional or social neglect. So could you go a bit on what that might look like to someone who may not know and may want to help a child, say a teacher or a guidance counselor who might want to be aware of those, what that looks like?
Yeah, so with that, I'm going to reference the Department of Children and Families has a great resource with a list that goes through as far as physical, emotional, sexual, and then neglect as far as those signs that you can look for. So they have a very long list, and I'm just going to share a few today as far as what some signs may be. So some unexplained injuries, such as bruises, extreme behaviors, excess crying, truancy truancy or running away, poor hygiene or unsuitable clothing, excessive fear of parents or caregivers, depression or excess crying, poor relationships or inability to relate to children of their own age, sudden change in behavior different than a child may typically be acting or typically would act, constant hungerness, tiredness, lack of energy, and attention-seeking behaviors. So with that, though, those are possible signs of physical, sexual, or emotional abuse or neglect. It doesn't necessarily mean that if you're seeing those behaviors that that's what it is, but these are possible signs. And the Department of Children and Families does have a longer list of possibilities.
Absolutely. And it's definitely one thing to know the signs, but it's another to also take action to say you want to help a kiddo out. Are there resources available, such as, if someone wants to be a foster parent or get a kid out of a dangerous or unhealthy situation?
So if you are a concerned community member and you have questions or concerns around if you're seeing those things, the Department of Children and Families does have a hotline which we can put up as far as if you have questions or concerns with that. In addition, the Department of Children and Families is always seeking foster parents. So in our area, Brenda Fitzgerald from the Department of Children and Families is the family resource recruiter, and we had connected about the need in our area. And she said for this area, there's actually a heightened need for teens. So there are foster families needed for babies, so 0 to age 22, but in our area or in actually all of Massachusetts, there's a heightened need for teens. So that is a highlight that she would like for me to share. And if it's okay with you, I'll just share a little bit of what she had shared with me.
Absolutely.
Okay. So the Department of Children and Families is actively recruiting foster parents for children in our community coming into care. They're searching for individuals or families with love and patience to help foster children. You can be single, married, partnered, divorced, or widowed. You can own a home or rent. They need they need homes for children aged 0 to 22, which includes sibling groups, children with special needs, medically involved children, and infants born exposed to drugs and older teens. One of the greatest priorities is teens. They need to create more safe, high-quality teen foster homes. They're looking for long-term foster care homes, but also have a need for emergency and respite homes, which involve a shorter time commitment on the part of foster families. Their goal is to provide our foster children with a supportive and healing environment in a home in their community until they can be reunited with their families or another plan is put in place on their behalf. If you're thinking of becoming a foster parent, you can learn more about the application process and supports from the Department of Children and Families. And for our area, Brenda Fitzgerald is the family resource recruiter, and her email is brenda.fitzgerald@mass.gov. And for some reason, if you have more questions about that, feel free to contact us and we can connect you with Brenda to answer the questions you may have about becoming a foster parent.
Absolutely. And again, all of that information will be in the video's description, and it will be available on our page when this is posted. So yeah, I know you might not know exactly why, but why is there a heightened need for specifically teens in Massachusetts? Is there a reason for that, or?
To really answer your question, I'm not sure,
Sure.
So I think that, the range, and I did look, so stats are a little interesting in Mass, but as far as what the numbers are in Mass, as far as how many children truly are in foster care, and I wasn't able to find this specific number, but for the years that I've worked in this field, it has been the adolescents that truly are the larger number that have more of a challenge finding foster homes. So I know it doesn't specifically answer your question, but for the years I've been in the field, teens have been that population that are more in need of foster homes.
That's really interesting to me. I would have thought it would go the other way with having younger kiddos having a harder time and teenagers. That's certainly very, very interesting. Yeah, so is there anything else you really want to add about specifically Child Abuse Prevention Month, if there's anything you guys want to add on that specifically?
So there is one other resource that I did miss. So there is an amazing resource. It's called the Parental Stress Line, which is 24/7, and it's volunteers who are trained are available so that if you're having a stressful moment as a parent, which happens more often than you may think, there is this amazing resource for you that you can call at any hour. So if it's 2 o'clock in the morning, your baby is crying, you don't know why, and you're completely stressed, there's this line that you can call and speak to a volunteer that can help support you, so that you're not alone and that you do have a connection with somebody, so that when you're feeling that stress, that you may act in a more appropriate way than you may be thinking. You know, sometimes stress can really get to you as a parent, so there's resources and supports there, so that can, you know, kind of bring you down from that moment and give you, I guess, advice from the volunteers on what you can do in that moment as a stress. Or it's a teen that said something to you in a way that you never thought a teen may say something to you, and now you have this stress, you have this line, you know, to call, and that's 1-800-632-8188, and that's the parental stress hotline.
I had no idea that existed. That's incredible. Yeah, that's awesome. So yeah, I don't really have anything else going through my little brain on regarding that. So that's awesome. We'll be sure to put that number in the description as well, so people can be aware of that. But more broadly speaking, I know we were talking about Public Health Week. Is there anything else you guys want to plug or add as our clock is kind of starting to run down?
I don't think so. I just look out for all the awesome things that we're bringing to Westford, guest speakers, different things that we do, like she already mentioned, the parent support group, and just know that you're never alone in any of this, and this is our passion, and we're here always to support and help, and I think that's it.
Awesome. And you're good?
Yes, thank you.
All right, awesome. Well, Nicole, Brittany, thank you very much.
Thank you.
Thank you.